Good afternoon. Thank you for joining us today, and welcome again to our Choices Community of Practice October Coffee Chat. I hope that everyone is doing well, enjoying your October. I can't believe we're nearly to the end of the month. Our topic for today is using local data to improve health and advance health equity. My name is Molly Garrone. I'm a Senior Communications Coordinator for the Choices Project at the Prevention Research Center on Nutrition and Physical Activity at the Harvard T.H. Chan School of Public Health. I'm happy to be facilitating this coffee chat today. As always, I want to acknowledge our funders who make this work possible and share that our Choices work and events are only for research and educational purposes. The intention of today's coffee chat is to provide information, tools, and resources to inform and educate, and we're not looking to influence any specific legislation. If you are unfamiliar with the Choices Community of Practice, it is a network that includes people whose work focuses on advancing obesity prevention, healthy eating, and active living, and want to learn more about how cost-effectiveness analysis can advance their efforts and address health equity. And it's our goal to support these efforts by providing tools, resources, and training opportunities. Our coffee chats are unique, informal opportunities to gather ideas, innovate together, and get to know each other better. So for today's event, we will be listening to a presentation from our guest speakers, and then we'll have time to get into some discussion and Q&A, and we really encourage all of you to share any questions or comments in the chat throughout the event today. So for today's coffee chat, we are excited to be joined by partners from the Centers for Disease Control and Prevention, who work on PLACES, which stands for Population Level Analysis and Community Estimates. So we'll be hearing from our speakers about different data and tools available through PLACES that can support our work in understanding the burden of chronic disease and prioritizing effective strategies to improve health and health equity. It's our goal today to really highlight the data and tools that are available through PLACES that can help support your program planning and prioritization. So we're excited to be joined by Dr. Susan Carlson and Magda Pankowska. Dr. Carlson is the lead for the Analytic Methods team of the Epidemiology and Surveillance branch in the Division of Population Health at the Centers for Disease Control and Prevention. The Analytic Methods team provides state-based and local level data on chronic disease risk factors and conditions to support public health planning. Before joining the Analytic Methods team in 2020, Dr. Carlson worked for 16 years in the Physical Activity and Health branch in the Division of Nutrition, Physical Activity, and Obesity. Magda Pankowska has been an Oak Ridge Institute for Science and Education, also known as ORISE, Spatial Epidemiology Fellow at the Centers for Disease Control and Prevention in the Division of Population Health for 2 years. Prior to this role, she was a research data analyst at Boston Medical Center, researching the delivery of health services among cancer patients. She obtained a Bachelor of Science and Master of Public Health degree from Northeastern University in May 2020. So welcome, Susan and Magda. We're really happy to have you both here with us today and eager to hear your presentation. So I'm going to turn it over to Magda and Susan.
Great. Thanks so much, Molly, for the great introduction. As Molly stated, my name is Susan Carlson, and I am from CDC's Division of Population Health, Epidemiology, and Surveillance branch. Just for all of you to know, PLACES is conducted through a partnership between CDC, the CDC Foundation, and the Robert Wood Johnson Foundation. So today I'm here with Magda. We're going to provide you an introduction to PLACES and its many tools. I will provide a brief overview of PLACES, and then we'll turn the virtual floor to Magda to discuss all the tools that PLACES has to offer. And then I'll come on back and talk you through some case studies. Next slide, please, Magda. So the purpose of PLACES is to provide high-quality small area estimates of health across the entire United States. These estimates can be used in many ways. For example, the estimates allow users to explore local data to inform the development of activities and health objectives. They can help users better understand the geographic distribution of health-related issues, and they can help communities really identify priority health conditions and risk behaviors for action. For example, policymakers and other users can identify communities with high numbers of adults with obesity, and these data can help inform the actions needed to address any geographic disparities. Next slide. Places estimates are available for all counties and for most of the other 3 census geographies listed here. This includes incorporated and census designated places, census tracts, and zip code tabulation areas. Places began in 2020 and is an expansion of the 500 Cities Project, which some of you might be familiar with. Our 500 Cities Project provided data for census tracts in the largest 500 cities in the United States. However, the Places expanded that to include estimates across the entire United States. Next slide, please. Places currently provides estimates for 36 health measures. Measures were selected based on public health priorities and because they have a substantial impact on people's health. These measures also include risk behaviors that cause much of the illness, suffering, and early death related to chronic diseases and conditions. They are conditions and diseases that are the most common, costly, and preventable. In addition, to be included in Places, the measure needs to be assessed as part of our Behavioral Risk Factor Surveillance System, or BRSS, which is our primary data source. Definitions of the Places measures align with the work of the Chronic Disease Indicators Project. The Chronic Disease Indicators Project is our state-level tool, and you can link to that. You'll see the link at the bottom there. We'll now briefly review the Places measures that are included. Next slide, please. All measures are among adults aged 18 years and older unless otherwise noted. So in other words, Places does not include estimates for children or adolescents. There are 13 health outcome measures. These include measures such as obesity, coronary heart disease, COPD, cancer, and depression. Next slide, please. There are 9 prevention practices measures. They include health insurance coverage, access to care, visits to doctor and dentists, cholesterol screening, and several cancer screening measures. Next slide, please. There are also 4 health risk behavior measures. These include no leisure time physical activity, current smoking, short sleep duration, and binge drinking. We also have, next slide, 3 health status measures. These include measures of physical and mental health distress, which is defined as greater than 14 days, as well as a measure of general health status. Next slide, please. And we just, with our latest update for Places, which occurred in actually in July of this past, just a few months ago, in July of 2023, we also included 7 disability measures. This includes measures of 6 disability types, such as hearing, vision, and mobility, as well as a composite measure of any disability. Next slide, please. For today, because we are really trying to limit our talk to 20 minutes and make sure we have plenty of time for discussion, I'm going to very briefly discuss our estimation method, but we can, of course, circle back to this if others are interested. But Places uses a multi-level regression and post-stratification method to generate the estimates. So estimates really represent the predicted levels of disease and risk factors for a given geography based on our models. To generate estimates, we combine survey data from the Behavioral Risk Factor Surveillance System, or BRSS, and poverty data from the American Community Survey with socio-demographic data from the US Census. So in essence, in the first step, we create a multi-level regression model to predict each health measure. The second step is we take the parameters from the multi-level model and apply these to the census populations for the geographic level of interest. In the interest of time, again, we're not going to go through our methods in depth or our validation work, but further information is available on our Places website, which I think is provided in the chat. So now I will turn it over to Magda to talk about what is available on our Places webpage and all of our great tools. Magda?
Thanks, Susan. So on our Places webpage, you can find more information all about Places, as well as all of our applications and data products. So this includes all measure definitions for all 36 measures, more details about Places methodology that Susan mentioned, all of our Places related publications and on validation. We have a frequently asked questions section, and then we also have videos demonstrating how to use our Places applications and data portal. So kind of getting started off with one of our first applications, our interactive map, which you can access from the front page of our Places webpage. Our map application uses scale-dependent rendering, meaning that as you zoom in, you'll be able to view different layers. And we have some slides kind of showing how that interactive map can be used. So first, when you access the map, you can navigate to a measure that you're interested in by clicking one of the 5 categories on the top of the screen. For example, you can select the health risk behaviors category, and then select the physical inactivity estimate to view the estimate. And then in the interactive map, you can also view the layers and legend by clicking on the layers button on the right side of the page. And then also click on the legend by clicking on the legend tab to show the measure that you're viewing and the distribution of that measure. And in this example, we're showing the estimates by county. And if you zoom in, you can then view estimates by census tract. So here we're viewing the estimates for the prevalence of obesity. And to zoom in, you can either scroll on a mouse wheel on a computer mouse or by clicking on the plus sign on the left side of the interactive map. And you can see which layer you're viewing based on which layer is visible in the layer tab on the right side of the interactive map. And on the census tract level, you can see in the legend tab that the places, place boundaries, and counties layers are all grayed out. And the ZCTA layer eye-shaped icon has a slash through it. This all indicates that these layers are not being viewed. And then in contrast, the tracts layer is bold and doesn't have a slash through kind of the eye-shaped icon. So this is kind of indicating that we are currently viewing the census tract layer. And if you go in and deselect, I guess, the tracts layer and then select the ZCTA layer, you can then view estimates by ZCTA. And here is an example of the estimate for the prevalence of physical health that not being good for 14 or more days at this ZCTA level. And if you turn off the ZCTA layer and zoom in even further, you can view estimates by place, which includes incorporated and census designated places. And here we're viewing the estimates for the prevalence of lack of health insurance. Alternatively, you can also use the search bar in our map application for an easier way of viewing a place of interest. So you can search, for example, Worcester, Massachusetts, and this map will zoom into that place of interest. You can also alternatively search for a county of interest, and the map will zoom into the county that you're interested in. You can also click on any county, place, tract, or ZCTA of interest to see a pop-up, which will show the estimate for that area and the total population based on either Census 2010 or census population estimates for counties. And again, we're showing an example for Cambridge, Massachusetts, where the prevalence of diabetes was 5.1% in 2021. In our interactive maps, we also added links to census profile data at both the county and place level. And so when you click the link in the pop-up, it will take you to the census profile webpage for that area. And that link will access a new page that shows the census profile for the county or place that you selected. And this is where you can find up-to-date demographic, social, or economic information for a number of census sources that can help you understand more about that area. And here we're showing an example of a census profile for Boston, Massachusetts. Another Places application is the data portal, which you can access both on the front page of the Places website by either clicking on data for current release or our most recent Places data releases, or by clicking on data portal to see both current and past Places data releases, which includes the 500 cities data that Susan mentioned. And once you click on the data portal, that's where you can search for all Places data and then be able to view it and download it and also filter data for all 36 measures, all 4 geographic levels. And our data comes in 2 different types of formats, open data and GIS friendly. And once you locate the data set that you're interested in, you can find more information about that data set. And then also you can click on view data, which will allow you to apply filters and then download the data as a CSV or another file type. And in the interest of time, we won't dive too deep into the data portal, but happy to kind of answer any further questions during the Q&A session about the data portal specifically. Another Places application is the comparison report, which allows users to compare up to 3 counties or 3 places for all measures and save as a PDF or CSV file. And in this example, we're showing the place comparison report with the crude and age-adjusted obesity prevalence measures for 3 places, Cambridge, Worcester, and Springfield, all in Massachusetts. And to add a place, you can click on Add Place in the search bar. And to save, you can click on Save as PDF or Save as CSV in the top right-hand corner. And the county comparison report is also available, and you can find out by clicking on the County tab. We also have 4 services, 6 applications, and 37 individual maps available in our gallery on the ArcGIS Living Atlas of the World. The service can be used to download GIS data and add data to your GIS software to make your own maps to be customized for local use. And you can use the link on the bottom of the slide or the QR code to access our Living Atlas of the World gallery. And here we just want to provide some examples of the ways you can customize these maps in our ArcGIS Living Atlas of the World by creating a free ArcGIS online account. So we're showing a map for Massachusetts, both showing on the top the county level estimates for the prevalence of obesity, and on the bottom tract level estimates for the prevalence of physical inactivity. And if you need any additional help, please be sure to visit our help page, which has some helpful videos, FAQs, and how-to guides for all our applications. And you're also very welcome to reach out to the Places team by sending an email to places@cdc.gov. And I'll turn it off to Susan for some use cases.
Great, thanks so much, Magda. So many groups have used Places in sort of a variety of ways. So we thought we would just share a couple of those with you today. Next slide. One of our partners is the County Health Rankings and Roadmaps. The County Health Rankings and Roadmaps tool brings together sort of county level Places data with other data sources in an interactive tool that allows users to explore health measures and rankings across county. The web tool also includes an action center where community leaders can explore evidence-informed actions to promote health. So it's really a great resource for accessing Places data in a different way. And it also has not only Places data, but from various other sources. Our next example, next slide, please, is an example from a state level use. And this is Hawaii's Department of Health. They provide Places data as part of their one-stop shop for data and information about community health on the island. This website was developed through a partnership of Hawaii Health Data Warehouse and the Hawaii Department of Health, but Places is a key source for their county, place, tract, and ZICTA level estimates. Next slide, please. Many of you might be familiar with CDC's Division of Nutrition, Physical Activity, and Obesity's High Obesity Program. So the Places estimates, or the Places obesity estimates, were used to determine eligibility for their 2023 process. So here, applicants working with counties that have more than 40% of adults with obesity were eligible to apply. This program funds land-grant universities to work with community extension services to increase access to healthier foods and safe and accessible places for physical activity. We also, on our next slide, have an example of sort of communities using Places data. And this example comes to us from Milwaukee. Neighborhood leaders in Milwaukee wanted to engage residents on health risks and use Places data as part of their organized data chats. And our next slide is also an example of a community or using our Places data. So in Brooklyn, the borough president was undertaking a comprehensive planning effort to really drive long-term decisions to improve health outcomes and reduce disparities for residents. In this case, the borough president partnered with the New York Academy of Medicine and the Regional Planning Association to produce an existing conditions report. Within the report, the team used 500 cities and Places data, as well as a lot of our visualization tools to highlight major neighborhood level differences in chronic health conditions such as asthma and diabetes. So here's a quote from them. on, using the places and other data to call for more affordable housing and other policies to advance health equity. And here they really highlight the use of those visualization tools that Magda highlighted. And I'll turn it over to Magda to talk about our newsletter.
Thanks, Susan. So if you're interested in kind of staying informed about places, please consider signing up for our newsletter. We send it about quarterly. It's kind of great ways to kind of keep up with us and any related topics as well. And you can sign up by either scanning the QR code or accessing the link on the bottom of the slide, where you can enter your email address to sign up, and you'll receive an email confirmation asking you to sign up as well.
Great. So here is everyone on our Places team. This is truly a team effort. And today, Magda and I were just the lucky ones to present to you. But the Places team does include a multidisciplinary team of statisticians, epidemiologists, geographers, fellows, and specialists in communication and policy. So it's really a team effort to bring the Places tool to you. And we hope that you can take the time to explore the Places website and explore all the tools that we have to offer. And as Magda said, when you go to our website, there is a contact us option available. So please do reach out if you have any questions. And then I will say thank you for your time and thank you for inviting us. And we will go ahead, I think, and stop sharing and open the floor for questions.
Awesome. Thank you so much, Susan and Magda. That was a fantastic presentation and such a great overview of Places. I think you packed in so many great details in a short amount of time. So I appreciate that. I think folks will certainly have a much better sense of Places now. I know I definitely do. And it was especially great to see those examples of how communities have used Places. So thank you so much for that. So yes, we have an opportunity now for kind of Q&A and discussion. And so I'm going to kick it off with a question. Again, really helpful to learn how the data can be used to help understand the burden of chronic disease in specific localities. And kind of a big part of the work that we do here at Choices is understanding the potential impact that a program or policy might have on health behaviors and health outcomes related to nutrition, physical activity, and healthy weight. And so I know you were mentioning that Places data was used to identify areas with disproportionate impact of disease to determine high obesity program or HOP funding. And you also shared an example of data being used to help advance health equity. So I was wondering if you both could speak a little bit more to how people can use Places data to evaluate health disparities in their community or use it to prioritize programs that will promote health equity.
Great, sure. And I can jump in and then Magda can certainly add. But like you mentioned, Molly, the use cases that we talked about, like the high obesity program, is really about using Places data to prioritize resources. And that is one great use of Places data, is really for public health planning purposes and really thinking about where there are the largest geographic disparities, and then really combining that with other data. So we don't see Places as sort of a standalone. As you explore where the geographic disparities are, we do hope that those users kind of dive further into the data and think about, well, what does that community look like in terms of, education levels, age level, age groups present, sort of race, ethnicity. So really Places data sort of offers that starting point to allow users to look at the geographic differences that are sort of observed, but of course we don't see Places as a replacement for local data. We really see it as a complement to local data. For those communities that are able to collect data sort of on the ground and collect that direct information, we hope that they use that together with Places data for really that complete public health planning. I think as far as we do get this question quite a bit, is really, about evaluating sort of policies and programs. And really Places data, given that they are model-based estimates, are not meant for sort of evaluating whether your program is working in terms of effectiveness, but is really, meant to help communities examine what those geographic differences can be. So for example, if you're working at the county level, you might want to be looking at the tracts that make up your county, and looking to see, if you're working at the state level, it might be more appropriate to look at the county level. So I think it offers a lot of options to look at those different units and decide really what is best to inform what you want to do in your community.
Great. Thank you so much, Susan. I think you more than answered that question. I really appreciate all that detail. So thank you. I think there have been several questions that have come in through the chat, so I want to make sure to highlight those. There was a question if there's a measure for chronic stress.
Good question. So there is not a measure of chronic stress currently. So again, all of our places measures do have to be measured as part of BRSS. And I know that BRSS did include a question on stress in the 2022 data, but it's in an optional module. It's not as part of the core. But at this time, given that BRSS doesn't regularly assess chronic stress, then places isn't able to produce or generate an estimate for chronic stress.
Great. Thank you for clarifying that. And there's another question if places contains race ethnicity data. I think you said that it does. Is that correct?
So that's a good question too. So race ethnicity is part of our models. We include race ethnicity in part of our predictions. However, we don't include estimates of race ethnicity, but like Magda was pointing out, if you're in the interactive map, and you're looking at a place or a county, you're able to kind of click on that little, what do I call it, Magda? The little pop-up. Yeah, thank you. It wasn't coming to me. You can click on the pop-up, and there's a link there that will take you to census profile data, and that works for the county or the place. But otherwise, if you're just interested in the racial distribution within that community, you will likely need to, perhaps visit some of the census products to find that. But for the county and the place level, we do have that within our tool that you can click on a link, and that will take you right to not only the racial distribution of a county and place, but also information on education, income, so you can really dive further into what that community looks like.
Awesome. Thank you. That's really useful. Another question here is if places is related to county health rankings.
So County Health Rankings is one of our partners, and we County Health Rankings uses a number of measures from places. Some of the measures they include are publicly available measures, and we also provide them with a couple of additional measures that they then post on their website. So yes, and we talk to them regularly, and they're wonderful partners. And I think they, for us, it's really about having people use the places data, and that's the most important thing to us. So we love to have our partners presenting the places data and complementing it with sort of different information that is really in their wheelhouse. So we do work very closely with county health rankings and roadmaps. Sorry, I always forget there, and roadmaps.
Terrific. Thank you. And thanks, folks, for all the great questions. Keep them coming in the chat, and also feel free to unmute and ask questions. Another question I see here. Chad is wondering, can we map a county without software programs like GIS or Tableau? With the interactive map, it can be difficult to see some of those county or state lines. Can we omit other communities to isolate the one we're interested in for easier visualization?
I think maybe I can take that one. Personally, I'm not really familiar with software outside of ArcGIS. I know there's many other geographic software, but I'm not the best person to ask that question. And I think in the example we kind of showed how you can create a map within ArcGIS to kind of isolate a state. That I believe there are also options to isolate maybe specific county or specific counties within the ArcGIS platform. I know there's additional customizations that you can sign up for free in the ArcGIS online account, but outside of that platform, I don't think I can really provide that much guidance, but that's a great question.
Great. Thank you, Magda. Another question here, I'd like to combine low health insurance with areas of high Hispanic population. Is that possible?
That's a great question, I think. Yeah, that is something that is not possible currently with our interactive map, but stay tuned because we are trying to add those capabilities, is the ability to kind of not only open two maps side by side. So for example, have those things, but also be able to, stratify the places measures where you can select on another measure, but right now we don't have those capabilities. There are a couple, but I don't think that they have, there are a couple other CDC tools, but I don't think they have low health insurance. Another source, Lance, for that is the American Community Survey has a bunch of different tools, and they actually do collect information on health insurance and racial / ethnic distribution. So they might be another source, but that is something that we're definitely thinking about for the future. But right now our interactive application does not do that. But I would suggest looking around to see if there's any of the data tools from the American Community Survey that might be able to help with that.
Great. Thank you. And are there plans to add the YRBS Youth Risk Behavior Surveillance Survey to places?
Great, and thanks, Emily. That's a great question. And we're always looking to expand our small area estimation methodology to different data sources. For example, our statistician recently did a project to explore PRAMS, which is a pregnancy risk assessment. Oh, I'm going to forget. Maternal survey.
Yeah.
Sorry, too many acronyms. So we're always looking to expand our methods. One challenge with the YRBS survey is, appropriately so, it's designed that it's really nested within classrooms, within schools. So it is a bit challenging to think about how we get a large enough geographic spread, but that is always on our wish list to expand to different populations, including YRBS for the adolescents. We've also been looking at the National Survey of Children's Health to think about options there. So we're certainly considering it, and again, is on our wish list. We are a bit of a small team and have a lot of ideas, but certainly are interested in how can we make small area estimates available for children and adolescents, and to be continued as we have the time and can think through that some more.
Great, thank you. Yeah, I look forward to seeing more about that. I think it might have, was it maybe Courtney? Someone had a raised hand before, and I want to give you an opportunity to unmute if you wanted to ask a question.
Yeah, thanks. My question kind of sort of a piggyback off of a couple questions ago. And so the data sets that we can download from places are all the variables in that, like, we could put them into like stats, say, or into R, and we could like make those maps that are like overlapping some of those like more.
Oh, okay. Yep, I got you now. Yes, you can definitely do that, Courtney. You can, and I can put an example of a paper that we recently had in PCD where we did just that. We downloaded, well, maybe we didn't have to download them because we kind of have them, but we used the COPD estimates from places and actually combined them with SVI, the Social Vulnerability Index, and did just what you were saying. We kind of explored different ways to look at that, where we could sort of do some different bivariate mapping and then those sorts of things. So if you have those abilities, you can certainly think about how to do that. We did that. The example that I will put in the chat, or Magda, maybe you can find it too, is you can do that. And if you have those abilities, you can, if you're good at map making in SAS or ArcGIS or whatever you'd like, that you can think about either overlaying the measures that are already in places if you want to overlay two different measures, or even think about bringing it in. We also, on our website, we have a number of sort of SDOH data sets, or social determinants of health data sets. And we kind of call them that they are linkable to places because they're sort of at the same geographic units. And that would be another source. Or of course, if you're familiar with the American Community Survey or those types of things, you could certainly download the data and link them, either in SAS or your R or whatever you're comfortable with, and then make those types of bivariate maps.
Awesome. Thank you so much.
Okay, I'm glad I was just going to ask you, did that answer your question?
Yes, no, it did. And I'm glad that you provided the examples, because I'm very interested in going and looking and seeing like exactly what you did and how you guys did it. So thank you.
Great. And if you try it and run into any problems, please do let us know, because we're kind of interested in to see how it works for other people to do that. So please do keep in touch.
Awesome. I will. Thank you.
Great. Thank you, Courtney. Great question. And thanks, Susan. And thanks, Magda, for sharing those resources in the chat. I think one question I would love to ask, so when folks were registering for this event, they had an opportunity to share some questions in advance. And there was a question about how folks can supplement local community needs assessment data with places. So hoping you both could maybe touch on that.
Yeah, and I've sort of, that's a good question. And we have sort of received questions like that before, and it is a little hard because it's very scenario specific, but I know that people have used sort of places data as a way to kind of make their case, especially if they're looking at, it might be at the tract level. It really depends on what level they're looking at, but they might just want to use the places estimates to estimate, this tract has 7% prevalence of diabetes or 5% of this. So I've seen people use it in sort of that way, and sort of identifying which tracts maybe are the highest or the lowest, depending on the type of measure, and then diving into those areas further. So I think that's perfectly good use of places data in planning. And really, I think if you can supplement that with other data, either from other sources or that you've collected directly, I think that would be great too. But everyone's sort of these assessments do look quite a bit different, but I have seen people kind of list the places data as part of their needs assessment, and especially for identifying, those that are the lowest or the highest tracts or ZICTAs or counties or whatever level you're looking at.
Wonderful. Thank you. And I see another question in the chat. So Anna was asking, in Indiana, they have many rural counties with 5 or fewer BRFSS responses for any given year. Could you touch on how this methodology and estimation addresses the reportability for areas with such low response rates?
Yeah, so that's a great question. So that's a reason, why we have places in our methods, is because we have a lot of counties with low BRSS counts, and even though BRSS is, over, or close to 400,000 respondents per year. So the way our estimation process works is really we start with our first step is a model that predicts each outcome, and that uses all of BRSS. And we have a state and county random effect, as well as the ACS variables. And that is our first step, and that's what's used to predict. And then we apply those predictions to what your county looks like, what are its demographics. So really, places is a model-based estimate, and it is the predicted level of either the disease or the risk factor or the health status. It is not a direct estimate. We've done a number of, and if you go to our website, you can see we've done a lot of pieces that have really looked at how well it works. For the most part, we have strong correlation with those that are direct estimates. However, Anna, you might be getting at this, a lot of our reliability work is done, because we can only compare to direct estimates from sort of large counties. We show relatively good consistency. I think we still have a lot of work left to really look at the consistency, but right now we really show that the modeled estimates at the state and county level are very consistent with the direct estimates that exist. So that is, the reason of 5 or fewer is really the reason we have places, is so that we can get an estimate of small area, for these small areas. And it really does help you to provide what does this geographic distribution look like, but they are model based. Everyone should be keeping that in mind, that these are model based, and really the predicted levels. For example, if a tract or a county has a policy in place, or or even potentially have put new sidewalks in all of their you won't necessarily see that, given that the model doesn't include those types of supportive changes. So we should always be cautious that they are model based, which has an advantage in that we can do estimates at all of these different geographic levels, but the disadvantage is that it is model based.
Great, thank you. And thanks, Magda has put in the chat where folks can find more information about places, methodology, and validation. So thank you for sharing that. I'm going to ask a few more questions I have here that were submitted in advance, and I want to encourage folks. These have been great questions, so please keep thinking if you have questions or comments, and feel free to share in the chat or raise your hand or come off mute and share. But I also want to take a moment as well just to kind of pause and invite folks to share anything in the chat that you learned today, something that was new to you maybe, or a resource or something related to places that you're excited about, that you're going to check out after the coffee chat. We love to get a sense of what folks are taking away from our coffee chats. So please do share those takeaways that you might have in the chat. And then I'm going to turn back to our speakers with another question that was submitted in advance. How can we leverage data to fund programs in underserved communities?
Yeah, so I think, again, this is something we've heard from partners, but I've heard it multiple times, is that, people really do use places data to make their case. I mean, they really do, sort of like the HOP program used, it was that you are eligible for, the funding if you're working in a county that had greater than 40% prevalence. And that's what we heard mostly, is that people, when they're either applying for funds or they're seeking out funding, or resources or whatever the case might be, is that they try to make that case using the places data that our estimated COPD rates are this much. And I think as Magda kind of showed on the map, as you make those maps, it kind of shows you what the median is, and people make that argument of, we're higher than the median or lower than the median, or maybe it's that you see a good amount of differences within your county, and you maybe want to say, well, the tracts in the southern part of our county are really where this issue is. So I think we've heard, that's what we normally hear from partners. It really helps to make the case, not only to policymakers and decision makers, but even the community. Like our example in Milwaukee that group shared was really, that was about, making the community aware of what was happening. So I think it's all about, we call local data for better health, and it's really about trying to influence planning and resource allocation and I think whenever you can combine it with other data, I think that can only strengthen sort of your data story. And I think that's important, that not only, using places data just by itself, but whatever data you have at your level, whether it's directly collected or whether it's collected via, thoughts of the community and focus groups, I think all of that can help strengthen your data story.
Wonderful. Thank you, Susan. I think folks have shared some really nice takeaways in the chat. Carla shared that she had not heard of this resource, but will be incorporating into the research agenda. That's wonderful. Michaela, I like the comparison report. I want to try it out on a county level basis. So that is terrific. Jasmine shared she's originally from Milwaukee. That's great to hear. That's fantastic. So thank you folks for sharing those takeaways. Any final questions or comments from folks before we just share a couple of final points here?
Yeah, and I just wanted to jump in. I think, Michaela, thank you very much. I think I have seen sort of the comparison report used as sort of an easy way to even make your case. You know, you can pick up to 3 counties in 3 places, and I've seen people use that in a not maybe in a unique way, but maybe show, you know, how much how different some of the counties in a given state can be. And I think that can help to really solidify a point that you're trying to make like that in a nice tabular format that's easy to do. If mapping is not your thing, I think that offers a nice alternative.
Great. Thanks for sharing that, Susan. Well, thank you, folks. And thank you to our speakers. This has been a wonderful presentation and a wonderful discussion. So thank you for answering all these great questions. So we're just going to share a couple final points here. So we always like to ask folks at the end of our coffee chats to share any suggestions that you might have for future coffee chats. You can also reach out to us at the Choices team to share anything. So please feel free to do that. We also want to remind everyone we have additional resources available from our Choices Community of Practice online portal. So you can register. Jenny from our team has put a link in the chat so you can register to access those resources. I'd also like to highlight that we have a post-event survey that should pop up on your screens at the end of the event today. And we really encourage you to share your feedback and your experiences. Should only take a few moments. So our next coffee chat will be, today was special. We held this on a Tuesday, but the next one will be back to our usual Thursday. So it'll be Thursday, November 16th at the same time, 1 p.m. Eastern. So we really hope that folks will join us then. And again, finally, I just want to thank our wonderful guest speakers again. Thank you, Susan and Magda. We really enjoyed having you with us and appreciate all the great resources and opportunities that you shared. And it was so great to get a window into the world of places. So thank you so much for your time, and we really appreciate it.
Thank you so much for inviting us. And I did just put a plug in the chat, you know, if anyone is there and uses places, we really would love to hear about it. We'd love to tell your story. Like we've told we highlight Milwaukee and the work going on in New York City, but we'd love to hear more stories. So please do let us know.
Fantastic. Yes, please do that, folks. Check in with the Places team. And so thank you, everyone. Hope everyone has a wonderful rest of your day. Thank you for joining us.